Hey everyone, welcome to another Wellness Wednesday inside of our community, our Diabetes Free Life community. I'm Dr. Botello, and today's topic, today's session that I want to have with you here is one I wish every diabetic could hear before they wasted another year just going about chasing numbers, because here's the truth. Most people don't fail to reverse diabetes because they're lazy. And I want to say that again. You don't fail to reverse diabetes because you're just flat out lazy. They fail because the system that they're in only gave them, they only gave them really half the roadmap. So let me try to explain it like this. If you've ever been told, just take your medications, cut the sugar, and you're just going to be fine, right? Well, what you've been sold is this management idea, this mindset that the best that you can do is just manage this problem. So let me ask you something right here, right? Let me ask you this. Has anyone ever explained to you why your body became a diabetic in the first place? Has your doctor actually sat down with you and ever said to you, here's what actually caused your cells to actually stop responding to insulin in the first place? And here's more importantly, here's how you go about fixing it at the root of the problem. Probably not, right? Because here's the thing, and here's the truth. The system, the way it's set up, isn't set up to reverse anything. It's set up to monitor. It's set up to medicate you. To stall, to try to stall the complications just long enough until unfortunately you just finally crash. And at that point, it's someone else's problem. That's why you wind up moving on from things like metformin and you go to Jardiance, and then eventually you wind up on insulin and you're still not feeling better. And by the way, all roads lead to insulin if you're a diabetic. And yet here, when all of this is happening, you still feel like you're putting on weight, you feel like you're putting on belly fat, you're still crashing at 3 p.m. in the afternoon, you still feel like something's just off. That's no one's just coming about and actually telling you why is it happening in the first place. No one is labeling it, no one is naming it, no one is actually telling you why is it happening in the first place. Because no one's ever told you. Here's the thing, diabetes just isn't a sugar problem, right? It's just not. It's a whole body cellular fire. And I know for many of you, this is the first time that you're hearing it, especially if you're new to the group, but I want you to picture something. I want you to picture sort of maybe like a smoldering fire. It's always just burning. It's burning under the floorboards of your house. Listen, if that's happening, you can repaint the walls. You can spray maybe some Febreze around. You can light a candle. But if that fire underneath just keeps burning, the house is eventually going to go down. And that's what's happening inside the body of most diabetics, and they don't realize it because this problem is a silent disease. Remember that. It's a silent disease until it's not. The medications, they bring down your blood sugars for a while, but they don't touch the fire. They don't touch the fire that actually caused this whole problem in the first place. So when you take a step back, you got to start asking yourself, well, what's driving the fire in the first place? Well, it's things like what we've talked about here in our group. It's things like inflammation. It's mitochondrial damage. It's things like toxins or toxicities. It's cortisol overload. It's gut breakdown. Things like infections inside of your gut, parasitic issues, worms. I don't know what it is, but there's something there. Those things build up this insulin resistance at a cellular level. And if you're not trying to figure out why it's there in the first place, you're never going to be able to walk away from it. If you're not testing or you're not going about treating those things, then you're just repainting the walls. All the while the house is just burning down. So let me tell you about Maria. She's a patient. She actually came to us last year, 54 years old. Maria, thank you for allowing us to be able to share this story. She had been a diabetic for 8 years. She was on 3 medications. She was so-called eating healthy. She was doing everything that she thought was right, but she still felt like she was falling apart. Like she had no energy. She felt like her hair was thinning. She was craving sugar at night. She couldn't lose a pound. She was just always tired. She was having these crashes. Her A1C was actually starting to creep up, even though she was following the doctor's orders, which were what? Trying to watch what she ate. She was taking her medications faithfully. She was trying to do a little bit of exercise. She wasn't perfect. But what we did was we knew this wasn't a character flaw. What we did was we sat down with her, we did an extensive case history with her, and then what did we do? We went about trying to figure out why this problem was there in the first place, and we ran comprehensive root cause panels. And here's the thing, guess what we found out? We found out that she has sky-high inflammation. We found out she had adrenal burnout. We found out that she actually had mold toxicity from a past water leak. She had a leaky gut that was actually triggering her blood sugars to spike, even after eating so-called healthy things like avocados and eggs. but nobody had ever tested her. Nobody had ever tested her that way. Once we started creating a specific comprehensive treatment protocol just designed for Maria, and we addressed all these root drivers, well, just less than just 4 or 5 months, she dropped her A1C by more than 5 points. She lost 30 pounds. She got off of all of her diabetic medications, and she said this, and this was the best part. She's like, I'm starting to feel like myself again. I'm starting to feel young again, right? She said that she had energy she hadn't seen in decades. And what Maria really learned was, what I want you to learn here today is this. Medication doesn't reverse this disease. If it was, I'd be all for the medications. You take the medications, the disease would go away, and you don't have to take these medications anymore. It's only by addressing the actual root cause of the fire can you actually figure out how to walk away from the fire. Inside of our practice, we talk about this often. We use a system called the root and fruit model. But what does that really mean? Well, we don't guess. We go about testing why these problems are in the first place. We don't go about medicating the symptoms. We map out why the fire is there. We don't blame our patients. I can't tell you how many times I've met with someone and they say, well, my doctor just doesn't believe me. We want to educate our patients. We want to empower them, right? And once you know what the root drivers are, well, then everything changes, right? You stop asking, well, why do I have to take this in the first place? You start asking real questions like, what's the real reason my body is out of balance? But more importantly, once you have that and once you understand why it's there, now you get the plan. Now you got the plan to go about how to restore it. Listen, if this is resonating with you, if you've ever felt like you were doing everything right or the best of your ability, but you're still not getting any better, I want you to know you're not alone. You've never been given the full picture. But that's why we host this group. That's why we do the educational events that we do. So listen, make sure you stay dialed into this group. Look forward to future dates that we're going to be hosting events where you can learn a lot more about why diabetes is there in the first place. We're going to show you the exact system that we use in our clinic to help patients actually be able to walk away, reverse their diabetes at a root level. No gimmicks, no fluff, just the science, just the strategy, the breakthroughs that are out there that most people unfortunately just never ever get. So if you're ready to stop managing, you're ready to stop and actually go about reversing your disease, then do this. Drop a fire emoji in the comment so I know that you're with me. Let's open it up. What I want to do is, as part of today's session, I want you to go ahead and give me what your biggest takeaways were. Tell me if you've ever been told that you just have to manage this condition, that's the best that you can do. Also tell me, what are the questions that you still have about root cause testing? What do you need to go about doing to figure out why this problem is there in the first place? So drop them below right here in this video and we're going to reply to them. So let's make sure you keep that fire burning in the right direction, right? Just actually make it go out, right? Because you deserve more. You deserve more than just managing a problem that just never goes away. You actually deserve a transformation. All right, I want to wish you blessings to all, and I will see you next time. We'll see you then.